Hey everybody, welcome to another video. I'm Dr. Gonzalez and today we are going to be discussing the blood vessels. But before we get started, two things. Don't forget to subscribe, like, and share this video. And I do have a question real quickly for everybody. What are those blood vessels that we use for measurement of pressure? And what are those blood vessels that we use for measurement of pulse? Leave me a comment and I will review it and also comment back. All right, let's get started. Blood is carried through the cardiovascular system by blood vessels. There are three basic types of blood vessels: arteries, veins, and capillaries. Typically, arteries will carry blood away from the heart. Meanwhile, veins will carry blood towards the heart, and capillaries are the site of substance exchange between blood and interstitial fluid. The walls of arteries are composed of three layers. The innermost layer is the tunica interna or tunica intima, which you can see right here. And it consists of simple squamous epithelium, called the endothelium, a basement membrane of connective tissue, and a thin elastic connective tissue known as the internal elastic membrane. Bordering this membrane is the next tunic called the tunica media, which is right here. This is the thickest layer that contains smooth muscle, which you can clearly see right there, and it contains elastic fibers. Contraction of the smooth muscle can cause a decrease in the diameter of the lumen known as vasoconstriction, and a relaxation that results in an increase in the lumen of the diameter known as the vasodilation. The smooth muscle will respond to impulses from the sympathetic division, causing these reactions. And the outermost layer is the tunica externa or tunica adventitia, which is this one right here, and it's composed of loose connective tissue. The largest arteries are called elastic arteries. Meanwhile, we also have muscular arteries that are smaller branches from the elastic arteries. And thirdly, we have these muscular arteries that eventually will give rise to small arteries. And finally, arterioles, which carry blood to the capillaries. So if we go to this picture right here, you see the arteries and arterioles giving rise to the capillaries. Capillaries are the smallest of the blood vessels for gas exchange, CO2 and O2, and their microscopic lumen limits the passage of red blood cells to one at a time. As blood exits the capillary networks, the first encounter is with venules, as you can see here, small tubes that are intermediary between capillaries and large veins. And then venules converge to form the larger veins. Veins have also three tunics: the tunica interna, tunica media, and tunica externa. Intima, media, and externa. However, the thickness of the wall is much thinner in veins, and the lumen is much larger. The tunica media contains few smooth muscles, resulting in an inability of veins to vasoconstrict or vasodilate. The thin tunica media also fails to prevent the vein from collapsing when it is not filled with blood. Blood flow runs through veins in under less pressure. So in order for the blood to reach the heart, movement is assisted by skeletal muscle contractions, respiratory movements, and the presence of one-way valves, as you can see here. They are present in veins of the limbs and elsewhere to prevent the backflow of blood. The circulatory system consists of two main circulatory routes: the pulmonary circulation and the systemic circulation. The pulmonary circulation moves blood between the heart and the lungs, and the systemic circulation moves blood between the heart and the rest of the body. The pulmonary circulation is the easiest one. It consists of the pulmonary trunk, pulmonary arteries that are carrying deoxygenated blood towards the lungs, and pulmonary veins that are returning that deoxygenated blood into now freshly oxygenated blood back into the heart. Now let's discuss the systemic circulation. Remember that the systemic arteries are carrying blood away from the heart. Mostly this blood is going to be oxygenated, and the systemic veins are returning that blood from the body back to the heart. And remember, this blood is going to be mostly deoxygenated. Some of the most important arteries and veins that are attached to your heart, it's the aorta, also the inferior vena cava and the superior vena cava. Branching out of the aortic arch, we have three branches or three arteries. First is the brachiocephalic trunk, which eventually will branch into a right subclavian artery and a right common carotid artery. The second branch is the left common carotid, and the third branch is the left subclavian artery. The branches of the external carotid arteries will supply the external structures of the face, neck, and head with oxygenated blood. So some of the arteries you will see here coming from the common carotid arteries, it's the external carotid arteries, the facial artery, lingual artery, superficial temporal, and occipital arteries. We also have some deep arteries of the head and neck, such as the internal carotid, maxillary, and vertebral arteries. Now let's discuss the ones that go to the brain. The circle of Willis, it's one of the structures that are supplying the brain, and mostly these arteries come from the internal carotid arteries. So they're forming the circle of Willis. And so the circle of Willis, you can see, will give you some branches like the anterior cerebral artery, middle cerebral artery, and the posterior cerebral artery. The circle of Willis also contains alternate routes in case of blockage. So we have the anterior communicating, the posterior communicating, and the basilar artery that comes from these vertebral arteries. Lastly, we also have these cerebellar arteries that supply the cerebellum. Now let's discuss the arteries of the upper extremity. So here these arteries will come from the subclavian artery, which eventually will branch into an axillary artery, and will give you other branches such as the thoracoacromial trunk, costocervical trunk, and thyrocervical trunk. In the upper extremity, also coming from the subclavian and axillary, we're going to have this brachial artery, which will give you some branches such as the profunda brachii. But also coming from the axillary, we have the anterior circumflex humeral and posterior circumflex humeral. Going to the upper extremity, we also have these arteries that go to the forearm and hand, such as the radial artery, ulnar, and notice that both of them branch from the brachial artery. I'm not able to click it right now, but they come from there, radial and ulnar. And then we also have this deep palmar arch, which gives you also another metacarpal and digital. And there's also another palmar arch known as the superficial palmar arch. In the thorax, we also have other branches of the thoracic aorta that supply the thoracic region and intercostal spaces with oxygenated blood. So for example, we have these intercostals 1 through 11. We have the subcostal and the internal thoracic or mammary for the breasts, and the musculophrenic. In the branches coming from the abdominal aorta, we have the celiac trunk, the superior mesenteric, and the inferior mesenteric. Now, coming from that celiac trunk is like these common hepatic, splenic, and the left gastric. And also other branches coming from the abdominal aorta is the renal arteries, the gonadal, median sacral artery, inferior phrenic arteries, and lumbar arteries. The arteries of the abdomen, we have the gastroepiploic artery, the pancreaticoduodenal, the gastroduodenal, and the artery to the tail of the pancreas. We also have the gastric artery, the common hepatic, which I mentioned earlier, the proper hepatic, cystic artery, and splenic, which I mentioned earlier. In terms of the arteries that go to the intestines, we have the superior mesenteric and inferior mesenteric, which I did mention earlier, the ileocolic and superior rectal. And we also have the left colic artery, right colic artery, middle colic artery, and sigmoid artery. Branches of the common iliac arteries supply the reproductive organs and pelvic muscles with oxygenated blood, and these arteries come mainly from the abdominal aorta. So here we have the common iliac arteries, then the common iliac become an external iliac and an internal iliac. Notice that the external iliac goes towards the area of the lower extremities, meanwhile the internal iliac goes towards the pelvic area. And we also have the superior gluteal coming from these internal iliac. Also on the pelvis, we have the obturator arteries, the iliolumbar arteries, the internal pudendal arteries, and the lateral sacral. And all of them are going towards the area of the pelvic region. Now the lower extremities are going to be supplied by these external iliac, which eventually becomes the femoral artery. So the branches of the femoral artery supply the leg and foot with oxygenated blood. And from here we have several branches, including the profunda femoris or deep femoral artery. Notice we also have the medial circumflex femoral artery and the lateral circumflex femoral artery. Also in the lower extremity, continuing through that femoral, then it becomes the popliteal artery on the area of the knee posteriorly. So notice that it goes from anterior to posterior. We also have other branches such as the descending genicular. We also have the fibular or peroneal arteries, and anterior tibial artery, and of course posterior tibial artery. Lastly, on the foot, we have the dorsalis pedis, which is one of the arteries mostly used for pulse measurement. We have dorsal metatarsal arteries, digital arteries, and the arcuate artery. And we also have on the plantar area the plantar metatarsal arteries, the deep plantar arch, medial plantar, and lateral plantar artery. Now, most of the veins in the body have similar names as the arteries. However, there are going to be certain exceptions. So in this video, I'm only going to explain or show you those exceptions. And we're going to start in the thorax. In here, remember, from the heart, we have this superior vena cava as well as the inferior vena cava. And over the heart, we also have these brachiocephalic veins. Now, if we go towards the head, we're going to follow that superior vena cava. But remember, the veins are going to bring deoxygenated blood from the body back to the heart. So over here, we have the external jugular, which is one of those exceptions. And notice that the other veins have similar names as the arteries. And also, we have an internal jugular. Inside the skull, we have certain venous sinuses. So these venous sinuses form a connected set of chambers that drain blood from your brain. So here we have the superior sagittal sinus, the inferior sagittal sinus. We have the carnosinuses, and we have the petrosal sinuses. We also have the occipital sinuses, the transverse sinuses, And we have other sinuses such as the sphenoparietal, the confluence of the sinuses, which is that area right there, and the sigmoid sinuses. In the upper extremity, one exception that you can observe here, it's the basilic vein, a cephalic vein, which is this one right here. And we also have the median cubital vein, which is a very common vein for obtaining blood samples. The azygous system, so we have the azygous system that forms a network of vessels that drains the thoracic wall. We have the hemiazygous and the accessory hemiazygous. The hepatic portal system. So here you have the hepatic portal vein, and this hepatic also has the hepatic vein, splenic, gastric, gastroepiploic, and cystic. But the most important one is the hepatic portal vein. Great saphenous vein, which is that big vein you see right there, and the small saphenous vein. And if you like this video and you want to know more about this information, you can click on the card on top of this video where you can see more information about the cardiovascular system, or wait at the very end so that you can observe those suggested videos. And that's it for today. Thank you for watching. Again, please don't forget to subscribe, like, and share. And if you have any comments or questions or suggestions, you can also leave them on the comment section below. And that is it. I will see you on the next video. Bye. And if you like this video, you can... I blanked. And if